Norgart, and I waited a long time to spend time with my grandkids. I'm a 59-year-old grandmother of 2 beautiful grandkids. I served Iowa 6 for 36 years as a registered nurse until I retired. I like to volunteer at nursing homes. I like to garden. I like to help my family, and my favorite is playing with my grandkids. But please remember, as I read this, I have been a criminal. I contracted polio as a baby and now have suffered with post-polio syndrome since 1989. It causes more severe muscle weakness, chronic severe muscle pain, and spasms. My diagnosis is chronic severe pain due to post-polio syndrome. I'm currently on the highest dose of methadone, which is a synthetic morphine that I'm able to take, along with Neurontin, which is used for pain control. These medications have many serious side effects. They cause fatigue and depression. There's a lack of motivation. Since 1989, I have had 2 bleeding ulcers, each time nearly dying and requiring transfusions from the complications of pain medications. Last year, I tried cannabis for 2 months. Within 2 months, I had weaned myself off of all of my pain medications. My kids noticed a big difference in my attitude, such as more alert and happier. I did not use cannabis around my family or if driving. I slept all night and was pain-free. I had not experienced this in years. Why did I take a chance of being arrested and deemed a criminal? Because I want a quality of life. I want to be pain-free. Because this medicine helps me. This medicine takes away all my pain for many hours. I want to be able to take this medicine legally. I want to be able to play with my grandkids without pain. During my nursing career, I've taken care of hundreds of patients who still suffered even with strong pain or treatment medications. Synthetic drugs cannot always resolve patients' symptoms and instead causes more complications. Every synthetic pill you take has side effects and complications. No one has died from a cannabis overdose, but many have died from a prescription drug overdose. What about Marinol, the synthetic pill for cannabis? Marinol only provides relief to a limited number of patients, particularly when compared to natural cannabis. Patients prescribed Marinol frequently report that its psychoactive effects are far greater than that of natural cannabis. Everything I'm telling you about cannabis, I can prove from online studies. I'd be glad to forward them to anybody. Many of you are concerned about the 17 diagnoses which are listed in New Mexico's regulations for medical cannabis. Numerous recent studies prove that medical cannabis helps patients with these diagnoses. Please understand, these 17 diagnoses are severe, lifetime, debilitating diseases. Most of these 17 diseases can kill. They are not the 10-day cold or virus you may get or a hemorrhoid. Every statement I say, I can find for you. Intractable nausea and vomiting. I have a dear friend who was diagnosed with stage 4 breast cancer 10 years ago. Her first round of chemotherapy, she used cannabis and sailed through it. An adult child moved home and she didn't use it the second round and was deathly ill. When used in conjunction with hepatitis C treatment, patients using cannabis healed 3 times as fast as patients who did not use it. Another study assessed the use of cannabis as a treatment for patients suffering from multiple sclerosis. That study determined that cannabis was superior to placebo in reducing spasticity and pain in patients with MS and provided some benefit beyond the currently prescribed medications. Several studies assess cannabis' ability to alleviate neuropathic pain, which is extremely difficult to treat type of nerve pain associated with cancer, diabetes, HIV, AIDS, spinal cord injury, and many other debilitating conditions. Each of the trials found that cannabis consistently reduced patients' pain levels to a degree that was good or better than the currently prescribed medications. The studies which utilized the so-called gold standard FDA clinical trial design concluded that cannabis ought to be a first-line treatment for patients with neuropathy and other serious illnesses. Several hospice organizations have also favored the use of cannabis. I've had the honor to be with many patients as they passed. Some patients may pass easily, but some struggle. They have a lot of anxiety, fear, and pain. The drug of choice for pain is morphine, which many times cannot control it. Many patients are confused or near a comatose state due to the high level of medications. Cannabis would be an effective alternative to dying ions and could be used as a liquid under their tongue or as a vapor. Cannabis would make passing so much easier. In 2010, the Pharmacy Board found in favor of a program for medical cannabis. Reputable institutions have completed hundreds of recent studies which are positive for medical cannabis. Please decide what more you have to do and make this happen. I do not want to be a criminal for wanting to be a functional role in society and a quality of life.
Thank you, Connie. If